stand up and stretch. We're at a health conference, right? So stand up and stretch. And I've got a question for you. And the question is this: how are you feeling? How are you feeling? It's a question that's asked in exam rooms across the nation millions of times every day, right? We all know the situation. We've all been in the situation. You're in the exam room. You're up on the table. You might have on that gown with no back. You're sitting there tentatively. It's a quiet room. You hear that soft knock on the door, the pause. Someone comes in, and the question is asked, how are you feeling? And my question for you is, what do our patients tell us? Do they tell us how they're feeling? Do we really know how our patients are feeling, and how do we use that information to provide great care? So think about that same question when it's posed by, let's say, your sister or a close friend who asks you, how are you feeling? And my bet is, in addition to saying, geez, my back is bothering me, or I didn't sleep so well last night, you're also likely to share all the rest of how you're feeling, the excitement you have about something great that's happening with one of your kids, or the nervousness you have about a new job, or perhaps it's the financial insecurities that you have, the concerns you have about household bills that you don't know how you're going to pay, or the concern you have about elderly parents who need care and you're concerned about the care coordination that they need to have. So all of those things you share with people as a way to express how you're feeling, and it's not just what's happening with you physically, it's what's happening with you holistically. And so today I want to talk about how do we provide better care for people, how do we get to know and use information about how our patients are really feeling to produce better health across the country. And I think it's possible, and I think the time is now. And the way at it is really to take a look at what do we know about putting together how people are feeling? How do we broaden it and take a more holistic view? And I think the time to do that is now. And part of the reason is we know from the evidence that only about 20% of mortality and morbidity relates to what we do in our clinics and our hospitals. Traditional access to care really contributes about 20% to mortality and morbidity. We know that 80% of health and well-being relates to what's going on in our schools, in our homes, in our communities, in the rest of your life. So why is it in healthcare that we don't pay attention to how do we integrate that into the care that we provide? And we can. And I think that the place to start is with measurement. In healthcare, we do a better job when we can measure and know if we're on track or not. Think about the infection rates. We're not there yet, but we know when we pay attention and we track rates of infection, we can put in place interventions to produce better care. Or think about care for patients with diabetes. Once upon a time, we thought blood sugar was the thing and the main thing we needed to monitor to make sure we provided great care to patients with diabetes. By looking, though, more comprehensively at our patients with diabetes, we discovered that we needed a composite measure, that in fact, in addition to blood sugar control, things like cholesterol, blood pressure control, taking an aspirin a day, all of those things really contribute as much to providing great care and helping our patients with diabetes manage their health. So too in a summary measure, so too in this area of how you're feeling, we need a way to measure health and well-being more holistically. And I think the way we do it, and we've been looking at this at HealthPartners for the last couple of years, is consider a new composite measure, where we take a look not only at your clinical current health status, but more broadly at you as a person, and look across the population to get a sense of how we can measure health and well-being. So I want to share with you a summary measure of health and well-being, and the three parts to this summary measure of health and well-being. So where do you start? And the magic in this measure is it's a composite measure, so it's all three parts put together. It starts with current health. And this is what we today think of in terms of disability-adjusted life years. It's a global measure, recognized globally, used across not only the nation, but across the world to measure disability-adjusted life years. We can tell across a population what current health status is. It's good, but it's not enough. So then you take and you supplement that knowledge with sustainability of health. So what's in sustainability of health? Think about it as healthy behaviors. What's the lifestyle you lead? What are your health patterns? Do you exercise? Are you eating right? Do you have adequate sleep? Are you living in an environment where you can walk? Are you in a safe neighborhood? Do you even have a roof over your head? The social determinants of health really create the pathway that allows us to determine whether or not your current health, is sustainable for the longer term. So that's the second piece of the measure. The third piece of the measure is life satisfaction. And this is a qualitative measure where we ask patients, how satisfied are you with your life? Really important. After all, it's not care we want to provide to people, it's care we want to provide in partnership with people. So how our patients feel about their life, how they feel about their health, how they feel about what's going on around them has a lot to do with health and well-being. And so when we put these three singular measures together into a composite measure, we've been able to learn an awful lot about the population that we provide care to at HealthPartners. And this measure is in its infancy. Some would say it's not quite ready for prime time, but I think it's really important to share at a conference like this, because I think as years go by, in the future, this summary measure of health and well-being will become as useful and as commonplace as some of our other measures we've used to figure out, are we improving in what we do? So what have we learned so far? Let me share just a couple of examples with you. The first is a clinical example. When we looked across our commercial population, those people actually are commercial and Medicaid and Medicare population. So all of the individuals that we provide health insurance to at HealthPartners, we provide coverage to about 1.8 million people. And as we looked across that population and we used this summary measure of health, we discovered a really interesting thing, and that is 44% of the illness burden of the population of people who have our coverage fell into three buckets. The first bucket I'd call bone and joint disease, musculoskeletal conditions. That's the first category. The second is neurological conditions. So think headaches, migraines, think Alzheimer's, think anxiety. The things that fall into neurological conditions is the second category. And the third is mental health. And mental health may be not so surprising to many of us because we recognize that oftentimes mental health accompanies other chronic illness and disease, accompanies bone and joint disease, accompanies some of that neurological condition, and many other healthcare conditions as well. So 44%, nearly half of the challenges that our patients and our members face fall into those three buckets. So the question then is, well, that's interesting. What do you do with that? Why does that matter? Think about the potential for us providing better care in those areas when we focus on this broader notion of health and well-being. So let's talk about an orthopedic example. We know 8 out of 10 adults have neck or back pain at some point in their life. If I pose the question beyond the pedometer question, how many of you at some point have had neck or back pain? I think probably 8 out of 10 of you would raise your hand, right? Very common. Why is it important, and what's the potential? Think about that summary measure of health. Neck and back pain is not simply a clinical condition. It has a lot to do with your lifestyle. It has a lot to do with your life satisfaction, right? Think about how many back surgeries happen across this country that don't fix the problem. We live in a culture where we expect medicine to fix it instead of heal it. And this summary measure of health and well-being holds the potential for changing the dynamic in healthcare where we focus and we get back to the business of true healing as opposed to fixing. It holds the potential for having different kinds of conversations with patients with back pain. So hopefully we can eliminate some of those surgeries that aren't going to end up with a positive outcome. Clearly some of the back surgeries will be necessary, but too often we know back surgery happens and the problem's not fixed. Medication is given and we end up with addiction issues, not a fixed back. At HealthPartners, we have a program called Physicians Neck and Back Centers, where we have physician-guided neck and back strengthening programs that help support our patients who have neck and back pain with neck and back strengthening and actually produce a better outcome for many, many people than a surgical intervention would do. So this measure will help us figure out where else do we need to make those kinds of investments, really to produce better health, not only for our patients, but in the community as well. And that raises the second area of potential for this measure. As we think about the fact that an awful lot of health happens outside of an exam room, outside of a hospital, this measure will allow us to figure out which community partnerships really hold the most promise. How can we, as a health organization, partner in the community, for instance, to reduce the stigma around mental illness? Mental illness is a tough subject for people to talk about. We all know it. Any of us who've had friends who have a child with a mental health condition, much more difficult to talk about. When you have a child who has cancer, that's a tough situation to talk about, but people surround those families and support families. If you have a teenage or college-age kid who ends up in the psychiatric unit with a mental health breakdown, how many of your friends surround you and provide support? We're not equipped today to have very effective conversations around mental health. We need to reduce the stigma of mental illness, and we cannot do that as a healthcare system. We need broad community support and dialogue. The summary measure of health and well-being allows us to elevate that conversation as well, which I think raises the final point around what the potential is for this measure, which is really to change the culture in health care, to have us think about how do we put our patients in the driver's seat. Current health is something that we can assess clinically. Sustainability of health requires a dialogue, doesn't it? You can't know that on your own. And life satisfaction requires the patient to come forward with their perception, and their perception is the answer. It's the other interesting thing as we look at the data, and that 44% in the 3 buckets I mentioned earlier. The most interesting thing about life satisfaction is you find that your current health may or may not correlate as directly as you would think to life satisfaction. So what about that? And how is it that we can better support people with life satisfaction through how we interact with them? So from my vantage point, as we use this summary measure of health and well-being and move forward, the time is now. And part of the reason the time is now is our data and analytic capabilities today are so much greater than they've ever been. Imagine, back to that original question I had for you, how are you feeling? Can you imagine a day when you go for a doctor's visit, or you are on your phone having your doctor's visit, and the question, how are you feeling, comes up? What if, in addition to just the answer, the clinical answer of physical health, there were a way to move beyond some of the assessments we do right now, to have a broader sense, a comprehensive sense, a population measure sense of how are you feeling. Think about the power to take a population health measure, apply it to provide better care. Think about how we can provide better care once we understand our patients more broadly than simply the way we do today, simply current health. Think about the potential for more empathy. Think about the encounter, how it changes the satisfaction that clinicians have in practice by being able to understand their patients more holistically, and think about our ability to really be able to take that understanding and partner in the community in new and different ways. From my vantage point, as I look at that question, how are you feeling? If we can provide better care because we know our patients and we're able to build trusted relationships with them based on knowledge of who they are and what's important to them, we'll be way ahead. If we can have compassion, if we're able to be compassionate and have empathy, all the better. Better in the relationship. And ultimately, if we're able to improve community health and we're able to tackle some of the tough issues that can only be solved in partnership with broader communities, I think we'll all feel a lot better. Thank you.